Good morning, everybody. This is Michelle Shields, the Staff Development Coordinator at the Holgate Center. Today we're going to do the second training for the Oklahoma Nursing Home Oral Care Project. Just as a reminder, I'm talking about the teeth. The teeth are the beginning of your digestive system. The food enters the mouth and the saliva glands are activated. The saliva softens the food as the teeth grind and mash, causing the food to break apart into smaller particles. The tongue then pushes the small particles to the back of the mouth to be swallowed. Therefore, the fewer teeth the resident has, the less chewing they can do. The food is not ground into small particles, so the digestive system has to work harder and may not be able to properly digest. This creates problems with nutrition, which leads to reduced health, which could be poor wound healing and just not healing at a good enough rate. Some residents may pocket their food in their mouth, which could be a result of an inability to chew adequately to allow food to be swallowed. And really the bottom line is poor oral care equals poor health. Okay, let's get started with some pre-assessment questions. Teeth should be washed once a day for 2 minutes, twice a day for 2 minutes, twice a day for 1 minute, or once a day for 1 minute. The answer is twice a day for 2 minutes. Pre-assessment. Which area should you brush last to prevent gagging? Upper outside, lower inside, or upper inside? And the answer is lower inside. What can you do to help a resident with dry mouth? A, offer plenty of water. B, use artificial saliva products such as biotin. C, use xylitol products. D, all the above. And the answer is D, all the above. What angle do you hold the toothbrush while brushing? A, 45 degrees, B, 25 degrees, C, 35 degrees, or D, 10 degrees. And the answer is A, 45 degrees. Last question. When brushing dentures, you should use toothbrush and toothpaste, mouthwash and toothpaste, denture brush and dental paste, or dental tablets and water. And the answer is denture brush and denture paste. Okay, so daily oral care strategies and oral care planning. You will be learning today what to include in the resident's oral care plan, how to set up for providing daily oral care, how to perform proper daily oral care, and adaptations for special needs. When you're putting together your oral care plan, you need to take into consideration, do they have teeth, dentures, or partials, or maybe a combination? Can they brush their own teeth? Preferred tools for brushing their teeth, and any special precautions or restrictions. Special considerations would include, do they have dry mouth? Do they have thrush? Do they have ulcerated mouth, sores? Do they have any special restrictions? So for the resident with dry mouth, we definitely want to offer them plenty of water, use artificial saliva products, xylitol products, and offer water-based lip balms to keep their lips moist. When the mouth is dry, the tongue can sometimes stick to the roof of the mouth and cause swallowing difficulties. Residents may stop eating due to this discomfort, and when this happens, keeping mouth tissues moist is super important. Dry lips also need to be moist in order to eat and communicate comfortably. Saliva substitutes are available and can be applied directly to the resident's mouth. Xylitol helps increase saliva production. There are several different things you can do to help treat the dry mouth, and adding xylitol to these things can help improve their effectiveness even more. In case you're not familiar with xylitol, it is a natural sweetener. It has an antimicrobial property that cleans the teeth and moisturizes the mouth without any harsh chemicals or detergents. that could cause more dryness. You would need to notify your RCM, RCC, or your charge nurse. If you have a resident that has dry mouth, they can call the doctor and get an order for Biotine or xylitol. For residents with thrush, this would require prescriptions. They would have an antifungal prescription medication, and it's important to soak their dentures overnight in a chlorhexidine gluconate mouthwash. Both of those things would have to be prescribed by the physician. So if you notice thrush, make sure you're reporting it to your RCM, RCC, and charge nurse. For sores, ulcerated mouths, you definitely need to consult a doctor or dentist for a prescribed analgesic mouthwash. They have those that are both swish and swallow and swish and spit. They usually have some kind of lidocaine or numbing medicine in it that soothes those sores and helps them heal. You need to offer water to drink. Sometimes they want it cold, sometimes they just want it room temperature. And then really consider putting them on some vitamin C to help promote the healing as well. And that would also need a physician order. So some special restrictions. Residents should not be given mouthwash, toothpaste, or water if they're comatose. That's obvious. If they're care resistant, nothing by mouth if they're MPO, swallowing problems, or cannot spit. Now, let me say this. If they're care resistant, that doesn't mean we don't offer them water. It just means that, it has to be supervised. So what you'll need to set up for your oral care are these products. Dental floss. I'm not really sure if we even have dental floss. So that's something we need to check into. Towels, goggles, glasses, mask, gloves, all that stuff. Residents with dentures, obviously a dental brush, dental paste, and make sure on their dental cups that you are putting their name on there and their room number. So you want to take 60 seconds each day to perform a daily oral health assessment. Oral hygiene techniques. Let's go through. While you're setting up supplies, you want to greet the resident and explain what you're doing. If they have dementia, make sure you're greeting them with a smile, lower your voice tone, and do it at an eye level. Positioning resident for care really should be seated during oral care unless they're able to stand at the sink and do their own oral care. That's great. Standing behind them allows for better access to their teeth, and this also minimizes neck strain and back strain if you stand slightly behind them. If the resident is in bed, sit or stand beside their head. Stabilize the mouth using your thumb gently on the resident's chin. And for people with dementia, position yourself in front of the resident. In this case, standing beside or behind the resident does not allow them to anticipate what might happen and may discourage their participation. So after you position the patient, you make sure you want to wash your hands. Put on your goggles, your mask, your gloves. How much toothpaste do you use? Well, I'm probably the worst at using way too much toothpaste, but this is on the left is way too much toothpaste, and on the right is the appropriate amount. You just want to use a pea size. The abrasiveness found in toothpaste helps remove the plaque from natural teeth, but should not be used on dentures. That's why we use denture paste, not toothpaste. And you want to choose a toothpaste with fluoride. Fluoride's important for preventing tooth decay. If toothpaste causes a burning sensation, you just may have to try a different brand, or maybe the family needs to bring in their favorite toothpaste they use at home. How to brush the teeth. Brushing another person's teeth, it's a very difficult experience. It's a very different experience than brushing your own teeth. It kind of feels a little awkward. When brushing your own teeth, you're getting feedback from within your own mouth, which lets you know how clean your teeth feel, or if there are any tender or painful areas. You do not have this benefit, obviously, when you're brushing somebody else's teeth, and you must rely on verbal or nonverbal feedback from your resident. You want to pay attention to nonverbal cues. It's really important for residents with limited communication skills. Brushing teeth twice a day for 2 minutes. If residents are brushing their own teeth, do not rush them. If you can only brush once in a day, night brushing is the most important, but we really need to strive to brushing our residents' teeth twice a day, and prompting them. If they can brush their own teeth, set them up and prompt them to brush their teeth. How to floss. There are a variety of floss and floss aids available commercially. Interdental brushes have a handle which helps to access the back of the teeth. Interdental brushes can be used with mouthwash or toothpaste. Handles should be rinsed after use. The tips and brushes should be placed when worn. Toothpicks fit in spaces between teeth to gently massage gums and remove debris. I would not use a toothpick on a resident myself. If they're alert and oriented and they want to use the toothpick, that's their choice. There must be, you just have to use very good care to avoid any damage to the gums. There's floss handles, there's a picture of a floss handle there at the bottom left, are helpful so that care providers can avoid putting their fingers in a resident's mouth when flossing. Use good position when flossing. You want to pinch the floss between your thumb and index fingers, glide the floss between the teeth, and slide under the gums using a C-shaped around each tooth. Pull out and move to next tooth using a clean section of floss. Gums may bleed during flossing, especially if they have gingivitis, and this is normal and usually stops as gums become healthier. Use an interproximal brush between teeth. This is not something we have here, and doubtful that it's something that we would use. Special adaptations. This would usually come from OT, can help with special adaptations for toothbrushes. And if you feel like your resident would benefit from something like this, then talk to your RCM, RCC, and we can find something from OT to help them. Special consideration would be to using a child's toothbrush. Now, all toothbrushes are appropriate for all people, obviously. There are a number of factors considered when choosing appropriate toothbrush for a resident. What is their ability to use a brush effectively without causing damage? Are there physical conditions to consider, such as problems in mobility, manual dexterity, vision, and so on? Are they motivated and willing to do their own oral care? There are many different types of toothbrushes. No one model of a manual brush is known to be more effective than another, but soft bristles are recommended. When using properly, certain electric toothbrushes can be more effective than manual brushes at removing plaque. Residents should have a toothbrush for their teeth and a different toothbrush or denture brush for their dentures. Toothbrushes should be replaced every 3 months and immediately following an illness to ensure that the residents are not re-exposed to bacteria or viruses associated with illness. So if they have a sinus infection, if they have pneumonia, you should toss their toothbrush and get them a new toothbrush. Very important. Clean dentures daily. A clean mouth requires clean dentures. Dentures should be cleaned at least once a day. Use a denture brush and do not use toothpaste. Dentures can be easily scratched by abrasives in the toothpaste. These scratches allow bacteria to grow on the dentures. So guidelines for denture care: you want to remove dentures, clean them over a sink lined with a face towel. That way if you drop them in the sink, they won't crack or chip. Lining the sink with a face cloth prevents damage. Liquid soap or commercial denture cleaning product, like a foam cleanser or soaking tablets, can be used to clean the dentures and partials. And mouth tissue should be cleaned with a soft toothbrush or a cloth. We have toothettes they can also use. Dentures should be brushed before being soaked. Dentures without metal can be soaked in 1 teaspoon bleach and 1 cup of water. We have tablets so that they can be soaked in. Dentures, patients should be encouraged to remove dentures overnight to allow the mouth tissue to rest. Denture comfort: ensure the mouth is moist when replacing dentures. Placing a water-soluble lubricant under the denture can also help with dry mouth. Partial denture cleaning: you want to clean the partial the same as you would a full denture. Be careful when holding and cleansing the clasp because those things can snap and they're very expensive to replace. And it's not a quick replacement. It takes a while. Here are some additional resources if you're interested. And there should be a quiz after you finish the 3rd training on this. Thank you guys very much. I appreciate it and have a great day.